I'm Noor Fatima. Guess what, guys? You're on Outlook Africa, the only reality show in India, which brings you day-to-day insights about Africa. We enjoyed reading your feedback last week all along regarding the deadly virus, Ebola. The message we have today is that it is not over yet. We will continue to bring you more details about the actual world public enemy, Ebola. And in this episode, to answer your questions, we'll speak to two distinguished guests who know all about Ebola, and all too well. In the first part, I'll speak to Dr. Didhi Srivatava, specialist in immunology. Ma'am, welcome to the program. It's great to have you here on Outlook Africa. You are a specialist in immunology and assistant professor at Amity Institute of Biotechnology. Ma'am, nowadays, thousands of medical personnel are gathered here at the Indian airport to monitor the deadly virus, Ebola virus. Ma'am, we would like to know what's your say on this virus.
First of all, thank you, Noor, for calling me in such a hot topic of the immunology field. Because I'm from that background, so I'm feeling very honored for that. And as far as Ebola is concerned, it's nowadays outbreak on the African country, basically in the Congo and the Sudan area.
Yes,
the
ma'am.
people, the Indians, those who are coming from that area, is naturally worried about the thing. Even the Indian government, even the Indians are worried about for the transmit of that disease to the India, because this disease is very infectious, fatal, and it's very infectious and fatal. So because of that, the Indian government is very much worried about that. For Ebola virus, as we all know that, it has been first detected and identified in the African country, basically in the Sudan and the Congo region. And this disease is because of, it is a viral disease, it's RNA virus disease. And what do you want to talk about this? You want to ask me that whether the Indian...
Yes, ma'am. How can they be affected or can they suffer from it?
We cannot deny that Indian cannot be affected by this disease.
Yes.
But this disease has been outbreak to that reason. So first of all, there should be a medium to transmit that disease from that region to this particular Indian places. And that very particular reason for the transmit of any disease is the people, those who are moving from that places. So the Indian government is taking a lot of care to scan that people at the international airport. Till now, as I remember, almost 1,000 people have come from that region to the Indian nation, and the Indian government has put the thermal scanner over there. That scanner actually scan the high body temperature. That is one of the most important symptom for that disease. So the people get scanned over there. But for me, it's not that particular way of screening to that disease, because that disease, after onset of the disease, it takes either 2 or days, minimum 2 days to the 1 week to get up to the symptom. So those who have high fever, they get scanned over there. But those who are in the window phase means the person who's carrying the virus,
Yes,
but it's not having the symptom. So that may be the fetal they may carry the disease. So for me, it is advised to the Indian government or to the health worker, those who are working on the airport, to scan that people. The person, those who are coming from that region, should be tested for the antibody and viral antibody and other means to have a positive symptom for that disease. But fortunately, till now, those people, those have been screened for the high body temperature, none of them has got the positive test for this disease. That's very good for
Yes,
the
ma'am.
immune system.
Ma'am, could you please tell us any preventive measures?
For me, the biggest preventive measure for any disease, not only for the Ebola, the person should have the positive attitude. They should
Yes,
always think that I'll be in a better position, because positivity give you a better immune system, and better immune system is one of the most important phase that give you strength to fight with any immune system. Preventive measure means, as far as I know, when a person is affected from this disease, they become so sick they cannot move. So with an infected person, transmission of this is restricted to some place. It is restricted to a place. So the person who's living nearby to that particular person should take a lot of precaution. It's spread through the body secretions, spread through the blood. So the person should take care of that, because it's not an airborne disease, so we should not be worried about that. It's only by the body fluid. So we can take care by wearing the protective clothes, or taking not to be contaminated with that body secretion.
Prevention is better than cure.
Prevention is always better than cure. And most of the thing, we should have a positive attitude for anything, that I'll be in a better phase, whatever I'm in. If I'm suffering from the disease, we should have the positive attitude.
Yes, ma'am. Ma'am, so could you please tell us about the preventive measures taken against this disease?
The best preventive measure we should take care of: do not have any contamination with the person who's infected, with their body secretion, with their blood, with the serum. As we know that we should not use any of the contaminated needle, syringe of the person who's infected. Even the dead person carry this virus, so that may be the way of contamination or for the transmission of disease. And so these are the precautions that we should take. The person who's taking care of the diseased person should have the better clothing, should wear the gloves and all, so that, because this disease only is spread through the body secretion contamination.
Yes.
So if we can avoid that, luckily it's not till now it's not has been reported that it's airborne disease. So there's no that kind of risk, and the person who's having this disease is restricted to one place because he's so sick he cannot move out. So those who are taking care of that, they should also limit their movement to a particular area. They should restrict for that, and by that way we can prevent the spreading of this disease. Prevention is always better than cure.
Could you highlight some, like up till now, the treatments or vaccination, any of this kind?
Till now, no vaccine is present for this Ebola virus treatment, and no specific treatment even, because the symptom like fever, headache, sore throat and all, these are very common, and not a specific medicine has antiviral treatment is there. The person who is suffering from this disease, the people are taking care by giving them hydration, because body gets dehydrated. So the person who is having this disease is commonly treated with any of the antiviral disease, but that is not working. So always in this, all the positive cases, mostly 70 to 90% death is reported. So till now, what we can imagine that the rate of death is so high, and we don't have any medicine for this. So scientific community is working for that, to get this vaccination for this and the medicine, so that we can get rid of this disease as early as possible.
Thanks, ma'am. Thanks a lot for all these valuable points. It was great having you on Outlook Africa. Let's go for our first break. Outlook Africa will be back soon.
Hustle, hustle. Trop d'avance comme Rolls-Royce sur moto. Fali Hippopa du Cap la merveille. Ah, ah, ah. Original, original. Laissez, écoutez bien. Original. Get up and dance, dance. Africa, viens danser. Europa, viens danser. America, let's dance. Sud-America, como estás? Asia, ahí no. Hepazuka, haya. Abidjan, on s'enjaille. Douala, Yaoundé, Makossa. Libreville, Oriengo. Angola, Bondia. Dakar, Nanga, Def. Mbala.
to Radio Amity 107.8, and this is still Outlook Africa.
Lady, sexy girl, come dance with me, do with me bad thing. 'Cause you're bad girl, I'm a bad man, bad man, bad man. I am original.
Namaste, salam, abari nihao to all you friends. If you have just joined us, we're discussing the world public enemy, Ebola. If you have a question, tweet us or Facebook us. In the second part, I'm joined by my colleagues Johan and Richie. We'll be talking to a father, a mentor, Captain H.A. Harphy. As a father, he cares too much about Ebola. Sir, we feel highly privileged to have you on our show.
Thank you, Noor Fatima. I am Captain H.A. Harphy. I'm an advisor in Amity Institute of Corporate Communications and Amity Institute of English Studies and Research. I'm glad to be here again. I've been coming on the radio Amity a couple of times earlier also. I'm thankful to you for calling me today again.
Thank you, sir. Sir, our eager audience is very keen to listen. What is your say on Ebola virus, which has engulfed many innocent lives and has put the whole world in a series of fear?
Though Ebola virus is not here, fortunately, in India, but at the same time, even if it has developed somewhere else, we feel the pinch of it equally, and we are really concerned about it. It has started actually in the beginning from Nigeria. The countries which are affected by Nigeria, Liberia, Guinea, but then it engulfed Congo also in a much bigger way than these countries where it originated earlier. And therefore, since all these countries are affected, we have got to take all precautionary measures to make sure that it doesn't spread further, and secondly, we contain them wherever it has already existed now.
So I'd like to know, is there any sense of fear here in India regarding Ebola? Since in Africa we have at least 1 million Indians living in Africa.
Definitely.
And these people keep on coming back here in India, on and on. Is there any sense of fear in India?
Till now, we are perfectly secure about what is happening in those countries and the well-being of our own nationals in that country. it is true that it is a spreading, but at the same time, our missions are there, and we are fully confident that anything which happens, which should attract our attention in a bigger way than what we are doing now, we will definitely be informed about it. And any time and every time, whenever there is a problem, we feel that our nationals are affected, we will definitely take the requisite action. And we have taken in many other places earlier also.
All right. Is there any case which has been reported till about Ebola in India? Because we keep on getting suspicion on TV about people coming from Africa. Is there any
Right.
case confirmed till now here?
Very correct, very correct. To start with, we have got to make sure that those people who are coming from the countries which are affected by this virus, they come here and do not infect other people here.
Of
And
course.
therefore, at the airport itself, there are investigations which are carried out
All right.
in general on those people who are coming from those countries, affected countries.
Right.
And if it is found that they have some element of virus in their body, they are quarantined for a limited period. This quarantine started at the Bombay airport by the Ministry of Health Affairs. And the Ministry of Health Affairs used to take care of that. But thereafter, it was necessary that they could be even hospitalized in a particular hospital in Mumbai. And that is what had happened there. So what we are sure is, if there is a person who is having this virus in any form and in any degree, that will definitely be screened at the time of his entry at the airport. And if it is found to be affected by that, he will be quarantined for a limited period.
That's true. India is such a huge country with over 54 crore people. So the question many individuals are asking here in India is to know whether Ebola can be spread to the public.
Yes, we must know, because the symptoms of Ebola, they are common with other systems. For example, we have influenza,
Yes.
you have other virus, where it is a question of high fever or just normal fever, and thereafter it is accompanied by headache and body pain all over. So to start with, is nothing like any other symptom. It is just like that symptom. But if these symptoms are followed by some other symptoms, for example, you start having dizziness, or you start having vomiting,
All right.
or there are diarrhea conditions, then coupled with these, if fever persists, if body all over the pain exists, if there is a still cough and cold, then you should be cautious about it. And must go for diagnostic treatment. Once the diagnostic action is taken, you will get to know whether you are affected by Ebola or not.
Of course.
And that is the right time. That is the right time. If you are affected, you go for a treatment. And any treatment given to a person at the right time, I am pretty sure that neither it will spread nor there will be any harm to any other person.
So people should know that you are the best doctor for yourself. You should be able to diagnose. You should be able to know what is going on with your body, and you should run to hospital. as
We
it
should
earliest.
always try and acquaint the knowledge which you have got about a particular disease and the scares which is being created all around unnecessarily, to clear those things and clarify the things which are really the fact. And therefore, when you are in a society, when you are with your siblings, when you are in a group of people elsewhere, when you are in a party or a club, elsewhere, everywhere, wherever you go, you must try and tell the people, because awareness is, and again, a very important factor. There should be true awareness in the masses, and that can be done by the people like us who know the thing, and they can contribute to the awareness with the rest of the people in the country.
Of course.
So, as the saying goes, that prevention is better than cure. So, right. So, in case if we do take preventive measures, so what would be the treatment?
Yes, very good question. You see, how does it spread? We have got to know this. Let us understand it. Primarily and basically, it is not an infectious disease. If I'm sitting with a person at a distance, there is no question of being affected by that. But at the same time, we know that it spreads by way of contamination with the person who has having some secretion. Maybe a sweat, his sweat even.
The body fluid.
The body fluid. And if you are in direct contact with the body fluid or any other thing which is coming out of the body, say the blood even, if you are in direct contact with that, that is the dangerous thing, and that is going to affect you also with the same virus. And therefore, you have only to make sure that the secretion which is there from the body doesn't come in contact with you at any time and at any place.
So we got today an interview on TV of the US President Barack Obama. He was speaking today in the White House. He just said that US now needs to send troops in Africa to help Africa contain the disease, and US is also planning to invest $1 billion to fight the disease in Africa. So what is your sense on all of this? Is it not that too much late?
Better late than never. That is my policy.
Yes.
But at the same time, it remains a fact there is a great resource which is being put up in that country. And it may not necessarily by looking into the logistics only. This may be by way of healthcare. What all is necessary to contain the disease in the country by way of medication.
Of course.
This will definitely contribute to that exercise, and therefore this is a great resource mobilization which has been done by the US.
Of course, and there are some kind of suspicion in Africa about what Ebola is, from where Ebola.
So recently, about yesterday only, a mother and daughter, they died because of Ebola. Like whole of the village left that place and shifted to another place. So basically it is superstitious.
Yes. You have to contain it at all levels.
Yes.
You have to contain it by way of putting the right awareness in the people. This is a complete picture where the masses are not at all informed correctly about it. And if they were properly briefed and they had full awareness of the disease, they would never have shifted from there.
So education.
So that is why I am saying that it has to be tackled at different levels. And at different, you see, health care is one, precautionary things are another, logistics is another, non-contamination with other people is another. Particular awareness in the entire society is an important and significant factor of the same.
So, sir, is Ebola becoming a political issue? Because we have just seen a lot of countries closing their borders in Africa. Even there is some kind of restriction in flights coming from Liberia, going to Nigeria. Is it becoming a continental or political issue? What is your account on all of this?
Again, there is no question of leaving the country, leaving the place where you are living. This is only because the people are not informed about it properly.
Of course.
There is lack of information, there is lack of awareness in the people. If they know that it can be contained wherever you are, you don't have to flee. You don't have to migrate to some other place for purpose of avoiding this Ebola. Ebola is there, but it can be contained conveniently and comfortably. And the first better principle is that there should be complete awareness about it. Once that awareness is there, this is care which has been committed. This is a care which is in the public to migrate from one place to another country, and thereby a situation which exists only on the medical front goes to the political front,
of course,
because it takes a different shape and form.
Of course.
So talking about the treatment, recently 2 American missionary workers infected with Ebola were given an experimental drug called ZMapp. So do you think, like India, I guess it is very ahead in producing vaccines and medication, do you think they should be giving a hand to this?
I am not aware of the researches made insofar as containing this Ebola virus is concerned. But there are researches made in other countries, and people are always going ahead in the matter of trying to find out more effective remedies and medicines which can be there. And those effective medicines should not necessarily be that costly that normal people do not have access to that. And therefore, it is not a question of having a research so that you find a treatment, you find a medicine for that. You have got to make sure that the medicine is such which is accessible to the common people.
Definitely.
So that is how it stands now.
Thank you, sir, for giving your precious time to Outlook Africa, Radio Amity 107.8 FM. It was valuable talking to you and to get all these details. We really enjoyed having you. And don't forget to tweet us and Facebook us. The show continues online. You can get the show on YouTube. Watch, like, and share. Goodbye from Noida.
Ça, c'est la techno-soukous. Ah oui, Lolongomba, le propriétaire de tous les
Je m'appelle Coupé Coupé Bibamba. Hey. Je m'appelle Coupé Coupé Bibamba. Hey. Zindakoti abimina malembe.
Kamana yo.
Zindakoti abimina malembe.
Wepa. Ja. Hey, 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 hey. Soulevez la patte.
You're listening to Radio Amity 107.8, and this is still Outlook Africa.
Ngana kuyiba tena kutenga mutu nusa yebi. Ebi loko toni boka. Mutu nusa yebi. Biloko toni boka. Shikati kankan kwenda sukuma shikati kankan. Shikati kankan kwenda sukuma shikati kankan. Ya. Hey. Stop.
Comment tu t'appelles?
Qui moi? Non lui.
Je m'appelle Coupé Coupé Bibamba.
Non l'autre. Préparez-vous, car les bonnes choses ne durent jamais. Attention.